Hi, I'm Jonathan Katz, CEO of MedAdherence. I'm one of the founders, and I'd like to tell you a little bit about our company today. Firstly, we're a mobile health company, and we've built a technology-based platform that allows providers and doctors to be able to reach their patients when they're not in the office or the hospital. What this does is it makes sure that these patients follow those instructions or care plans that the doctors have given them. The reason is that many people go home and don't do what they're supposed to, and that eventually leads to complications, readmissions to the hospital, or even more serious events that turn out to be very costly to the people that are paying for the services. So our goal is really to be able to make these patients stay on course, and that it can help improve outcomes. We also help them so that they can improve the efficiency of their team, because since we do a lot of this outreach for them, and ours is completely automated, cloud-based solution, we can reach these patients, make sure they're doing what they're supposed to be. If they're not, we can do an automated intervention, or we can notify the provider team that these patients are not doing what they're supposed to. By doing it this way, the providers can focus on those patients that are the exceptions versus dealing with patients that are doing whatever they're supposed to be doing. So what are we doing that really makes us different in the industry, and why do we think that we've got kind of the secret sauce or the formula to do this? Firstly, our model is very interactive with patients. So it's not about pushing information or reminders to the patients. It's really about interacting with them and making decisions. So we've got very sophisticated rules built in, and servers that reside on the cloud. So the patient can take their mobile phone and interact with us. It's almost like a conversation, and we can determine what they need to do, and we can also determine whether they're on course or not on course. We even have the ability to identify those exceptional or those extreme situations and direct the patient immediately or connect them immediately to a healthcare professional to deal with the current situation. The other thing is that we support multiple therapeutic areas. So we're not just a diabetes company or a CHF company. Our technology, and we designed this up front, supports a lot of different therapeutic areas, making this a tool that can be shared across a hospital or clinic or any one of our other customers. The third piece, which I think is really important, is that we intentionally design this as a low-cost and easy-to-deploy model. What that means is that you can sustain patients on these models. It's not like put them in the program for a month, then let them get out. They can be on this program for years, especially those with chronic conditions. And what we found out is that this is very appealing to underserved populations. So many of our customers come from those populations, and by interacting with this system, we can manage those populations in a very low-cost and very effective way through their mobile phones. So with all of this being done, at the end of the day, if we're not making an impact, then this doesn't mean a lot. But based on what we've seen, and what we've seen with the populations and the many patients that we have on the system right now, in diabetes specifically, we're seeing close to a 1.4% improvement in A1C levels, which is a very, very meaningful number with diabetes patients. And some studies indicate that should result in anywhere from a 15 to 20% lower cost for that patient. But anyway, that is really an important number, because as we talk to other customers, when they see that kind of information and those kind of results, they're very, very interested in the system. And because of the low cost, easy deployment, it becomes a much more easy short-term sale to make based on those results. So at the end of the day, the big question is, and especially to investors, is who pays for this and why would they pay for what we're doing? Well, obviously, we talked about the results earlier, and that lowers the medical costs, and there's also a very strong efficiency component for our customers in terms of they don't have to use expensive resources calling patients or trying to reach them. But the bottom line is that there are patients out there right now in many states, in many areas of the country, where our customers are at risk, meaning that they carry the risk that if the patient gets worse or needs additional care, they actually foot the bill. In California, Medi-Cal, the clinics that we deal with are all capitated. That means they get a fixed amount for the patients. So if we can keep these diabetics under control, they in turn keep more of the dollars that are given to them. So it's a very important direct connection for them to participate in programs such as ourselves. We have that in New York, where they've got captive management organizations that pay for this kind of care, and that they have fixed amounts that they have to work with. By employing services such as ours, they really help manage that risk and reduce the cost of those patients. The second point I want to make is that there is a huge disparity in care in this country, meaning that some people get outstanding care and some people get very poor care. So the federal government has put a lot of money, and is putting a lot of money, even under these circumstances, against improving the delivery of care to underserved populations. As a result, there are grants, etc., that are available, that have been funded, that we can take advantage of. For example, one of our customers is one of the Beacon groups, okay, and they have been given a lot of money to manage and improve the care of these underserved populations. We do not have to apply for the grants. What we do is we work with them in them hiring us as subcontractors to help improve the care. And since we are mobile-based, that is something that is very sustainable and something that is very cost-effective from their perspective. So the whole underserved market represents a huge opportunity for us in many states in this country.